What we'd like to do is begin with questions from both the left and the right from amongst the panel to clarify on any points or to provide perhaps a response to any other comments or misunderstandings. Indeed, to get past even these sound bites. Anybody? Doug, you're pretty passionate. Any good questions for the right-wing radicals?
I just have answers for them.
You just have answers. Give us one. Give us one. I mean,
okay.
What's your assumption? I could definitely say that.
What's my assumption? I suggest the right wing read some more Socialist. I mean, you really got it wrong on Trotsky, and I think you get it wrong on Lenin, and you might get it wrong on Castro, but you ought to read the newer ones.
Who?
Hugo Chavez, you ought to read him. I mean, it's really important that you read Hugo and the way his country is going, because your right wing is really blasting him too much. I urge everybody to go to Citgo and buy their gas.
Fascinating.
Can I keep going?
No, let me let him get just a response in quickly. So this is going to be fun.
All right,
any comments from the right on Castro, Chavez, Trotsky, or any other socialist, and why do you keep slandering socialism?
Is it okay if I address the single payer aspect of this?
Go ahead.
Go ahead. Okay.
I didn't mean you to do that. I'm just making
So the one benefit for a single payer system over a government-controlled health public option is that it does allow people to choose their own private doctors and hospitals. However, there are three issues that make a single payer unsustainable, specifically here in the United States compared to other countries. First, it still maintains a moral hazard of spending other people's money by force, by jail, meaning people will not be able to shop around for the best quality, best cost provider, and would simply go to the most expensive each time. Healthcare prices will continue to grow similar as it does today, because it will end up being a monopoly situation. Second, unlike other countries in Europe with single-payer systems, the U.S. has a military empire of over 700 bases in over 130 countries, spending nearly $1 trillion. The U.S. is subsidizing these countries in defense and stimulating their economies with our troops spending their markets. Despite not spending as much on their military, these same countries are also experiencing economic unsustainability with their programs are also heading into bankruptcy with their single-payer systems. But third, and most important, is that our current single-payer program in the United States for seniors citizens is under a $73.8 trillion underfunded liabilities, which means every taxpayer needs to give $675,000 today in order to keep our obligations just to our senior citizens. The reason why the Medicare system is in such financial crisis was that it was created as a pay-as-you-go system, where future generations pay for the next, as long as the future generation is bigger than the last. This falls apart when 68 million baby boomers, where the next generation was significantly smaller. Okay. Medicare beneficiaries will increase by 100% in the next 20 years, while the new tax-paying workers will only increase by 17%. Most significant is the fact that every year, Congress, both Republicans and Democrats, loots upwards of $150 billion from both our seniors' Medicare and Social Security trust funds. During the LBJ administration, the Democrat Congress voted to put the surplus funds of Medicare and Social Security into the general fund. This means that with any deficit spending, whether it's a bank bailout, cash for clunkers, or our never-ending wars and global empire, or even a public option, the first dollars removed are from our senior citizens' Medicare and Social Security funds. That is why there's no money in the trust funds, just a number of IOUs in the form of treasuries that future taxpayers, your children, will somehow have to pay in addition to the normal payroll and income taxes. Of course, even with plundering Medicare, our deficits are so large that it doesn't cover it, so that we have to borrow from China and Saudi Arabia and pay interest on that. And that doesn't even cover our controlled government spending. So the Federal Reserve needs to print money out of thin air. This causes the worst kind of tax. It's called the inflation tax, and this hurts the poor, the working class, and senior citizens with fixed incomes the most. This year alone, groceries have increased 20 to 70% in prices. Rice jumped from $5 a bag to $15. Fruits and vegetables have grown 30% higher. And many seniors can no longer pay for the same groceries they bought 8 months ago. And our administration has put a stop on Social Security cost of living increases for the next 2 years. This will drive more and more of our seniors into poverty, just as their Medicare benefits are slashed by this new health insurance bill. Of course, no one currently age 45 or younger will receive Medicare or Social Security because it has become insolvent. We need to protect our current generation of seniors who paid into the system their whole lives by eliminating big expenditures like our global empire and new entitlement programs that will increase the cost of health care. We need to let future generations have the ability to opt out of mandatory entitlement programs so we do not send our children and grandchildren into poverty. So,
Stephen, thanks for the filibuster.
yep.